Welcome to the third World Congress on Cardiometabolic Medicine. We are live from Leela, Mumbai, and we are having Dr. Sandy Gupta as our esteemed guest right from London. So, Dr. Sandy, what is the difference between the coronary artery disease in India and London?
So, Dr. Roopesh, thank you very much. So, it's interesting that I have been coming to India now for almost 3 decades, having been brought up in the UK. And every time I come back to a congress, it's the same topics we go through with coronary disease risk factors and whether we are making progress or not. And it's an interesting comparison because in the UK we have a big population from the Indian subcontinent, Indians, Pakistanis, Bangladeshis, Sri Lankans. And you know, compared to the white British, that population from the subcontinent in the UK, their death rate from coronary disease is 40 to 50% higher. And it has been for decades. And this population in the UK, we get the disease 10 years earlier. And I suspect from Indian perspective as well that it is happening at a premature age, and it's the same comparative risk factors. So I don't believe that one risk factor has more priority than another. They all deserve equal attention. So, for example, if we talk about smoking, tobacco, the first thing is to say that there are different kinds of tobacco. Whether it's chewing tobacco, whether it's inhaling, whether it's smoking cigarettes, and all the new concern with e-cigarettes. We have to remind people that for every 1 cigarette you smoke, you will lose 11 minutes of your life. And we also know that whilst in the West we have managed to reduce the rates of cigarette smoking and tobacco, there is still a big problem in the developing countries. And it's a shame because patients who smoke not only get coronary disease, they get cancer, they get premature disease head to toe. And we have to do a lot more as cardiologists, like we do with our coronary stenting, like we put in defibrillators, like we manage blood pressure. We need to play more of a role with smoking cessation. If we talk about cholesterol, I don't know whether patients realize that 70% of our blood cholesterol has nothing to do with the diet. It's the liver producing. And the patients need to know that you can have the world's best diet, but still have high cholesterol. And we have to go lower is better. And I think that's a nice little sort of summary answer for all the risk factors. And if we talk about statins, we need to tell patients the statins work on the liver by switching off the cholesterol and why they need to be taken, and they're safe. And obviously we go for more aggressive LDL lowering with higher risk patients. And it's interesting that if you look at, say, the Japanese population, they live long. They smoke a lot, and one reason why they may get less coronary disease is that their genetic cholesterol is lower. But it's not as simple as that.
So, how is the lifestyle in UK different from India?
So the lifestyle is not too dissimilar in terms of being a concern of obesity and weight gain and sugary drinks and fast food. But I think people are more conscious. They're now becoming aware, especially the next generation, in terms of vegan diets and the new concepts of intermittent fasting. And so I think the obesity, the weight, the dietary issues is still a concern because of the power of fast food organizations as well. And you know, we all like a takeaway. But I tend to tell patients that you need a bit of a life. There's no need to ban things. But if you know what is a luxury, you know, a burger, a kebab, you know, butter chicken, a samosa, and what is a routine? Carrot sticks, lettuce. So as long as you know what is good and bad and in moderation. I tend to try to be a bit flippant, and I said the message for cardiology diet is that if it's tasty, spit it out. Because often things that are tasty are sugary, sweet or fatty. But that's been a little bit flippant. But it's trying to get that balance. And, you know, if we link in diet, salt and hypertension as the next risk factor of discussion, I think we need to be pushing, this is particularly with the Indian diet, there's a lot of salt that is hidden. And people say, I don't add salt. But then you need to remind that it's the hidden salts. A bowl of cornflakes, 0.5 gram. 2 slices of brown bread, 1 gram. Tin of tuna, 2 grams. A Domino's pizza, 3 grams. So patients don't realize we need to be aiming for less than 6 grams, and it's all hidden. And that will knock off a few points on the blood pressure.
What do you think, how stress is affecting these disease incidents?
That's a really good question, because patients often ask, is my palpitations because of stress? Is my chest pain because of stress? And I primarily say, number one, I'm very selfish. I'm not a psychiatrist, and hence not going to diagnose stress and anxiety. My aim is your heart. Focus on the heart. And we have to prioritize the common risk factors, the smoking, the blood pressure, diabetes, cholesterol, and I think probably play down a bit about the stress. We can say that stress doesn't help and it's a cofactor, but I would not want to upgrade it. And I think one person's stress is another one's fun and games. It's relative. And also, if you look at stress, when you have bereavement, when your house burns down and you get the sack, that's stress. But then, if you have a row with a neighbor or you lose your car keys, that becomes stress. You miss your flight. So I think one of the things with stress is to say, how do we handle it? Because we're not going to rub it out. And you know, it's a bit like blood pressure monitoring. If you put a 24-hour blood pressure monitor on a patient and say, that was a terrible day at the office, those readings are not real, then you say, well, that was the real world. We are not going to rub out your stresses, but what we want to do is protect you. So by controlling your blood pressure, you'll be able to handle the stresses. That's my view, yeah.
So what is your take home for prevention of coronary artery diseases?
So again, a message that has probably been repeated for decades. I think prevention is better than treatment in a flippant way. We mustn't be negative, and patients need to know we have effective treatments, whether it's percutaneous, surgical or medical. But I think please don't wait for an event to change your life. Human nature is you stop smoking, you walk more, you eat better after you've had a stroke or a heart attack. Try and do it before. And that is linked in with the deal that health professionals do their bit, patients and families need to do their bit. You know, I tell patients, you know that aspirin a day is thinning your blood. You know that cigarette a day is thickening your blood. That aspirin's not working. Why are you taking it? So I think it's a bit like the debate, if you're a smoker, should you have bypass surgery? Because we know as clinicians, the grafts are going to block up. And there's a lot of ethical debate. But I think we have to remind patients, you're going to get a new set of arteries. We're going to improve your outcome. But if you don't look at your weight, your diet, your exercise, your tablets, and stopping smoking, you're going to come back earlier. So I think those are the kinds of approaches, but not to be too negative. And I often say to patients, you know your risk factors, you're a mess at the moment, but luckily this is an amber light. It's not a red light, and we've got to work together. And it's back to, I'm giving a talk today on smoking and heart disease, is back today to remind people that if you stop smoking, you know, within minutes and days, you can breathe better. Your heart rate comes down. Within weeks, your complexion gets pinker. And within a year, you've already halved your heart disease death rate. And by 10 years of stopping smoking, you're like a non-smoker for risk. And you need to give a positive spin. I think we're, maybe as doctors, have a bad habit of telling people off. But if we turn it around and say the positives, that would be just as effective.
Thank you, Dr. Sandy.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.